My name is Patricia Clarin Simpson with the last three-digit number 125, and right now I'm going to be talking about the background. So ergonomics in children specifically study and focus on optimizing the environment and tools that children use daily, especially to study. Ergonomic risks in children include mismatches between anthropometry and school furniture, heavy books to be carried in their school bags, excessive screen time, physical inactivity, and psychological disturbances. These unhealthy environments and habits will eventually lead to negative effects such as musculoskeletal pains, spinal deviations, shoulder level shifts, and psychological disturbances. It will eventually affect the child's overall academic performance and mental health if it's not handled properly. Acknowledging ergonomic issues can significantly improve children's development and also increase their productivity, especially when they are growing up and also later in the future. That's all from me. Thank you.
Good afternoon, my name is Silver Purbo and the last three digits of my name is 148. The problem formulation for the student project is: what is ergonomics in children? How does ergonomics affect children's growth pattern? What are the ergonomic risks posed in children's activities? What are the possible musculoskeletal health outcomes in children? What are the possible psychosocial and cognitive impacts in children? And what are the preventive and corrective strategies in children affected by ergonomics risk? For the objectives, define and explain what ergonomics in children is, explain how ergonomics affects a child's growth, identify and elaborate possible ergonomic risks in children's activities, identify and elaborate possible musculoskeletal health outcomes in children, identify and elaborate possible psychosocial and cognitive impacts in children, and identify and elaborate preventive and corrective strategies for children affected by ergonomic risk. Lastly, as for the benefits, this student project hopes to provide guidance for parents, teachers, and caregivers to create ergonomically safe environments for children, support school in designing classrooms, furniture, and schedules that minimize ergonomic risk, contribute to the academic understanding of a child's ergonomics and its effects on health, as well as serve as a reference for future research on child development, ergonomics, and preventive health strategies. That's all from me. Thank you.
Hello everyone, my name is Asikirana with drill student number 087, and now I would like to explain about the definition of ergonomics in children. Ergonomics in children is a subpart of ergonomics that focuses on designing products, environments, and activities to fit the unique anatomical, physiological, cognitive, and psychosocial characteristics of children. Unlike adults, children undergo continuous phase of growth and development, making their anthropometric dimensions, motor skills, and cognitive capacities dynamic and variable over time. This moving target nature requires ergonomic approaches that not only adapt to children's current abilities, but also anticipate their developmental progression. The scope of pediatric ergonomics centers on structuring children's daily activities, such as schoolwork, play, and physical activities, while emphasize preventive strategies to reduce musculoskeletal, visual, and psychosocial risks from poorly designed environments. Ultimately, pediatric ergonomics seeks to create a supportive system that promote children's health, learning, and overall well-being by aligning developmental stage with environmental demands. That's all from me. Thank you.
Hi everyone, my name is Patricia Lanjutan and the last three digit of my student number is 171. So now I'm going to explain about the anthropometric and growth consideration in children. Anthropometry refers to a non-invasive body measurement used to evaluate growth, nutritional status, and health. In children, it is essential for assessing overall health, nutrition, and developmental patterns, with growth serving as a key indicator of well-being. Current measurements include weight, height, head circumference, BMI, body circumference, and skin fold thickness. Accurate serial measurements can help detect underlying medical, nutritional, or social problems. Beyond pediatrics, anthropometry is applied to assess body composition in athletes, optimize performance, identify eating disorders, monitor obesity, and evaluate maternal nutrition. Because isolated values are not meaningful, anthropometric measurement must be interpreted using standardized growth charts. The CDC charts are based on U.S. children raised in different and diverse nutritional and environmental condition, while the WHO charts represent optimal growth in children under ideal circumstances. The CDC-1 defines normal growth between the 5th and 95th percentile, with the 85th and 95th percentile considered at risk for overweight. WSO used Z-scores with normal growth defined between -2 and +2 SD, making them applicable to all children worldwide, regardless of ethnicity, socioeconomic status, and feeding type. WHO standard also tends to classify fewer children as undernourished compared to CDC charts because they are based on multinational data. Specialized charts are available for children with conditions such as Down syndrome, Turner syndrome, and cerebral palsy, and should be used in place of standard charts when indicated. So there are a few anthropometric parameters in children. The first one is health circumference, measured up to 2 years to monitor brain growth and development. There are also recumbent length, used for infants and toddlers who cannot stand. And there is also standing height, measured in older children with stadiometer. And also weight, and also BMI, calculated from height and weight, recommended for children above 2 years old to screen underweight, overweight, or obesity. And there are also limitations to BMI. It does not directly measure body fat. The other data you can use is mid-upper arm circumference, simple tool for detecting acute malnutrition in children under 5. There are also waist circumference, measures central adiposity, and associated with higher risk of diabetes and cardiovascular disease. There are also lymph length. There are upper arm or leg, helps to assess proportional growth and guides the measurements. And there's also skin fold thickness, estimates the body fat percentage, but limited by variability. And the last one is Z-scores, increasingly recommended for defining malnutrition and tracking growth deviation, more standardized than the percentiles. In summary, anthropometric and growth assessment are vital in pediatric cares, serving as a window into child health, nutrition, and development. When combined with appropriate growth standards and accurate measurement techniques, they allow clinicians to detect abnormalities early, guide intervention, and ensure that children's growth is supported by the environment that matches their developmental needs. Thank you.
Thank you for the opportunity. My name is Putu, an Indian operative here with last 3 digit of the number is 159. Body posture is generally described as the manner in which the body is maintained in an upright position characterized by optimal stability with minimal muscular effort. During childhood, children acquire postural patterns that frequently persist into adulthood. Poor posture is associated with a wide spectrum of health consequences. Environmental and behavior factors that promote the adoption of improper body positions play a significant role as they reinforce maladaptive postural habits and consequently contribute to the emergence of postural abnormalities. In academic setting, prolonged static posture, inappropriate ergonomic conditions, and maladaptive postural habits have been associated with musculoskeletal pains. The classroom environment is a significant contributor to the onset of musculoskeletal symptoms in school-aged children. Prolonged sitting time constitutes a critical risk factor for lumbar pain. Mismatch between children's anthropometric characteristics and the dimensions of school furniture not only exacerbate the postural deficiencies and musculoskeletal pain, but also impede the concentration and learning capacity. Research revealed that children lacking an adjustable chair demonstrated a higher likelihood of abnormalities in the stature triangle region. Similarly, other research also concludes that appropriate furniture play a critical and complementary role in preventing postural defects among children.
Hello, my name is Putu Asmani Prilasini Mustawa, and my last digit number is 161. School-based ergonomics risk in children that are backs over 10 to 15% of body weight put extra load on the spine. Heavy back cause posture problems like scoliosis, uneven shoulders, and spinal curve. They also lead to back, neck, and shoulder pain. Poor back designs makes weight unevenly distributed. Carrying bags on one shoulder or by hand increases strain, and the prevention for this includes ergonomics bags, proper weight limits, and education. Thank you.
My name is Putu Andita Wirachayani, and my last 3 digit of ID number is 185, and I'll be presenting about screen time, technology use, and visual risks. So prolonged technological device usage leads to complaints including forward leaning, poor posture, neck or back or shoulder discomfort. Among all available technologies, mobile devices are the most used and most problematic. Mobile devices possesses higher posture complaints than structured technologies such as TV or laptop. The higher the screen time, particularly among those in the 13 to 15 age group, the greater the number of complaints and the poorer the posture.
Hello everyone, my name is Niputulan Prasanti with the last three digits of my NIM number 138, and today I would like to talk about the ergonomic risk of play and physical activity in children. Play and sports are very important for children's physical, social, and cognitive development. However, they also carry certain risks. Early sports specialization may cause overuse injuries and stress, while participating in different sports is generally safer and help reduce this risk. Playgrounds can also be a source of injury, especially when they are poorly designed, such as having hard surfaces, missing guardrails, or equipment that is not suitable for a child's age. The most common injuries are fractures, bruises, cuts, and sprains. In rare cases, strangulation from ropes or clothing can even be fatal. Head injuries, especially concussions, are also a serious concern in children's sports. For example, limiting heading in youth soccer has proven effective in lowering concussion rates. Environmental factors add another layer of risk. Children are more vulnerable to heat stress because they sweat less and have a higher surface area compared to their body mass. This makes them more likely to experience dehydration and heat-related illness. To minimize this risk, preventive strategies are essential. Using safe and impact-absorbing surfaces, ensuring activities and equipment are appropriate for the child's age, promoting hydration and gradual heat adjustment, and maintaining close adult supervision can all help keep children safe while they play and stay active.
Hello, my name is Nyaman Gedewira Gunadri Paramarta and my last three-digit number is 180 and I'm going to explain about musculoskeletal health outcomes in children. Excessive use of digital devices in children is now a major trigger for musculoskeletal problems. Unnatural postures, such as constantly looking down at a screen or hunching over a computer, have led to a dramatic increase in neck and back pain. In fact, lower back pain, once often associated with adults, is now common in children. This condition not only causes pain but also can interfere with participation in physical activities and reduce quality of life into adulthood. Furthermore, intense exposure of electronic devices is strongly associated with an increase in repetitive motion injuries, such as carpal tunnel syndrome or tendonitis, which can impair children's fine motor development. Therefore, it is crucial for parents and educators to take preventive measures by teaching proper posture, limiting screen time, and encouraging children to be physically active. So that's all from me. Thank you.
Thank you for the opportunity. First of all, my name is Putri Balkis Hansa Akansa with the last student digit number 136. Right now, I'm going to explain about the psychosocial and cognitive impacts in children from the ergonomic aspect. So, childhood is a period of growth in social, cultural, emotional, cognitive, and physical skills in the early life. Ergonomic environments are really essential to support learning and healthy development as a children. Bad early life posture habits in the school can also cause the musculoskeletal issues as an adult in the future. So we know that there is a standard classroom furniture. We call it one size fits all, and this can often causes the discomfort for the students. This poor ergonomics can lead to back, neck, and shoulder pain even in children and also teens. Musculoskeletal pain in children is linked to the psychosocial issues that we call stress. So this stress can cause the discomfort, diverts brain power from learning to managing pain. So the children are distracted for because of this pain, because of this pain feeling. So this creates a constant cognitive load, reducing focus and engagement of their learning process with the teachers and with other students in the classroom. And also, this chronic discomfort can lower productivity and overall learning outcomes. So that's all for me. Thank you.
Hello, my name is Ananta Wismaya with the last digit number of 198. Now I'm going to explain about preventive and corrective ergonomic strategies for children. Preventive effort focus on healthy routines before issue arise. For example, using adjustable desks and chairs so children sit with their flat feet, knees bent at the 90 degrees, and back supported. In technology use, devices should be kept at eye level and children should follow the 20-20-20 rule to reduce eye fatigue. Backpacks should be lightweight with two straps and not exceed 10 to 15% of their body weight. And regular breaks, stretching, and physical activity also help maintain posture and strengthen supporting muscles. Corrective strategy became necessary when early signs like back pain or eye strain appear. These include teaching proper sitting habits, physiotherapy, stretching, and strengthening exercise, or even using ergonomic cushion and footrests. For vision issue, adjustment in lighting, screen setting, or glasses may be needed. Importantly, parents and teachers play a key role in guiding children and modeling good habits. Maybe that's all for me. Next.
My name is Putu Adrian Maribawa with 3-digit number 134. Allow me to explain the conclusion of this paper. So ergonomy is needed because children changes dynamically. With their growth and development, they may encounter many ergonomic hazards such as inactive sitting, incorrect posture, poorly fitting furniture, heavy school bags, and other hazards. They may experience bodily and psychological impacts, for example, musculoskeletal disorder like low back pain, neck pain, and repetitive strain injury in the wrist, physical discomforts, short attention span, and anxiety. We needed to take preventive and comprehensive corrective strategies such as providing fitting furniture, teaching kids how to handle and lift school bags, enforcing the 20-20-20 I rule, frequent movement, breaks, and physical activity. So the conclusion is we need to create the environment that fits to the children.